Imagine taking a medication that's meant to help you relieve pain, lower blood pressure, fight infection, only to find out it's quietly damaging one of the most important organs in your body. For seniors especially, the liver plays a critical role in staying healthy, yet it's often the most overlooked. In today's video, we're diving deep into 10 common medications that can slowly destroy your liver, and the warning signs your body gives you when it's starting to fail. Stick with us, because what you learn today could protect your health, your future, and even your life. The liver's role and why seniors are more at risk from medications. Your liver is like the body's chemical processing plant. It filters everything you consume, whether it's food, drink, or medication. It breaks down toxins, produces bile to help digest fats, stores vitamins and minerals, and helps regulate your hormones and blood sugar levels. For most of your life, this organ does its job quietly and efficiently. But as we age, everything starts to slow down, and the liver is no exception. For seniors, this means a reduced ability to process certain substances, especially medications. The liver becomes more vulnerable, its enzymes less active, and blood flow through it often decreases, all of which compound the risks of medication-induced liver damage. Seniors also tend to take more medications at once, a phenomenon known as polypharmacy. According to a CDC report, over 40% of adults aged 65 and older take 5 or more prescription drugs daily, not to mention over-the-counter supplements or painkillers. While each medication may be deemed safe on its own, together they can overwhelm the liver's detox system, leading to a buildup of harmful substances. Certain types of medications are metabolized by specific liver enzymes. When these enzymes are busy processing one drug, they may not be able to handle another properly. This causes toxic levels of the second medication to accumulate in the bloodstream, often without warning. A liver under stress doesn't always show immediate symptoms. But over time, the damage can become irreversible, leading to conditions like fatty liver disease, hepatitis, or even cirrhosis, a severe scarring of the liver that can be life-threatening. Moreover, many seniors already have pre-existing health conditions, diabetes, hypertension, or cardiovascular issues that make the liver more susceptible to injury. These conditions either require medications that are hard on the liver or cause inflammation that impairs liver function. Another hidden factor is dehydration. Seniors are more prone to dehydration, and the liver depends on adequate hydration to function properly. When you're dehydrated, the liver's ability to flush out toxins diminishes, which heightens the toxic effects of medications. Similarly, a poor diet, common among older adults due to changes in appetite or chewing ability, means the liver lacks essential nutrients it needs to regenerate and protect itself. A diet low in antioxidants and high in sugar or processed foods further burdens the liver, especially when combined with medications. It's important to know that liver damage is often a slow and silent process. You won't necessarily feel pain, nausea, or any symptoms at first. Many people only realize something is wrong when routine blood tests reveal elevated liver enzymes or when symptoms of liver dysfunction, like fatigue, yellowing of the skin, or swelling, suddenly appear. This is why awareness is key. Seniors need to have regular liver function tests, especially when starting new medications or when taking multiple drugs over a long period of time. Simple blood panels can catch abnormalities early and give your doctor the opportunity to adjust or remove the offending medications. Even seemingly harmless medications, like acetaminophen, ibuprofen, or certain herbal supplements, can pose a risk. And let's not forget alcohol. While not a medication, many seniors still enjoy a glass of wine or beer, not realizing how it interacts dangerously with liver-metabolized drugs. This combination can fast-track liver damage and raise the risk of acute liver failure. It's also worth noting that age-related changes in body composition, like increased fat and decreased muscle mass, can affect how medications are distributed in the body, putting more pressure on the liver to maintain balance. In essence, the liver is constantly multitasking, and as we age, it struggles to keep up. That's why it's critical for seniors to understand how medications impact this vital organ. Talking to your healthcare provider, regularly reviewing your medication list, avoiding unnecessary drugs, and keeping a close eye on your liver health can make all the difference. Prevention is far easier than treatment when it comes to liver damage. In the sections to come, we'll dig into the specific medications most likely to harm your liver, how to recognize early symptoms, and what you can do to stay protected. Over-the-counter painkillers, the silent liver saboteurs. Most people don't think twice before reaching for a bottle of over-the-counter painkillers. After all, they're available at every pharmacy, don't require a prescription, and promise quick relief from everything from arthritis to back pain to common headaches. But what many seniors don't realize is that some of the most common pain medications, especially acetaminophen and non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and naproxen, are quietly responsible for tens of thousands of cases of liver injury each year. Acetaminophen, also known by brand names like Tylenol, is one of the most widely used pain relievers in the world. Yet it's also the leading cause of acute liver failure in the United States. When taken in doses higher than recommended, or even within recommended limits over a prolonged period, it can overwhelm the liver's ability to process it safely. The liver breaks down acetaminophen into harmless substances, but a small percentage becomes a toxic compound called NAPQI. Normally, the liver neutralizes NAPQI with a molecule called glutathione. But when glutathione levels run low, as they often do in older adults due to malnutrition or chronic illness, NAPQI builds up and begins to destroy liver cells. The danger with acetaminophen is that the line between a safe dose and a toxic one is thinner than most people think. For a healthy adult, the maximum daily dose is 4,000 milligrams, but even just 5,000 to 6,000 milligrams can cause significant damage, especially if taken regularly. Seniors are at even higher risk because they may have slower metabolism, reduced liver function, or be taking other medications that interact with acetaminophen, increasing its toxic effects. What's worse, acetaminophen is found in hundreds of combination medications, including cold and flu remedies, sleep aids, and prescription drugs for pain. Many people inadvertently double dose by taking multiple products that each contain acetaminophen, unaware of the total amount they're consuming in a day. This kind of unintentional overdose is one of the most common causes of liver injury among seniors who genuinely believe they're following directions. Then there are NSAIDs, which include drugs like ibuprofen, Advil, Motrin, naproxen, Aleve, and aspirin. While these medications are primarily known for their effects on the stomach, kidneys, and cardiovascular system, they can also cause liver inflammation and damage when taken excessively or over long periods. NSAID-induced liver injury is often underreported because the symptoms are subtle and easily mistaken for general fatigue, flu, or age-related weakness. These drugs can lead to a condition known as drug-induced hepatitis, where liver enzymes become elevated and inflammation sets in. In rare but severe cases, NSAIDs can trigger autoimmune-like reactions in the liver, where the body begins to attack its own liver cells, causing long-term damage or failure. The risk of liver injury increases dramatically in seniors who combine NSAIDs with alcohol, other medications like methotrexate or statins, or who already have liver conditions such as fatty liver disease. What makes these medications particularly dangerous is how deceptively normal they seem. Their easy availability and wide use create a false sense of security. Many seniors may take them daily for joint pain or inflammation, not realizing that their liver is slowly struggling to keep up. Some studies have shown that even low doses of NSAIDs taken regularly over months can cause subtle but cumulative liver damage. Unlike a sudden overdose, this chronic damage builds over time, often without noticeable symptoms until it reaches a critical point. Seniors should also be aware that taking painkillers on an empty stomach, during dehydration, or while fasting can increase the strain on the liver by changing how the drugs are absorbed and metabolized. Doctors often caution against the daily use of these medications, especially in older adults. Yet many seniors don't report their usage because they consider them harmless. A seemingly innocent routine of taking a few painkillers each day just to get moving in the morning or to sleep better at night can spiral into a pattern of liver stress and dysfunction. To protect the liver, it's crucial for seniors to follow strict dosage guidelines, avoid combining pain medications unless directed by a healthcare professional, and have regular liver function tests if they are taking these drugs frequently. Seniors should also consider alternative methods for pain relief that don't involve daily medication, such as physical therapy, acupuncture, warm compresses, stretching routines, or low-impact exercises like Tai Chi or swimming. Anti-inflammatory diets rich in omega-3 fatty acids, turmeric, leafy greens, and berries can also help reduce chronic pain naturally while supporting liver health. It's also essential to read labels closely. Seniors and caregivers alike should be in the habit of checking the ingredients in every medication, especially combination products. When in doubt, it's better to ask a pharmacist or doctor than to make assumptions. Keeping a written list of all medications, including over-the-counter drugs and supplements, and sharing it with a healthcare provider can help prevent dangerous interactions and duplications. Seniors should also steer clear of expired medications, which can degrade into more toxic compounds, further stressing the liver. Finally, it's worth noting that some people have genetic variations that make them more susceptible to liver injury from painkillers, even at lower doses, making individual monitoring all the more important. The bottom line is this: just because a drug is sold without a prescription doesn't mean it's safe for daily use, especially not for aging livers. Over-the-counter painkillers may be convenient, but without careful use, they can do more harm than good. Seniors must approach these medications with respect, knowledge, and caution. Staying informed and being proactive about liver health isn't just a recommendation, it's a necessity. Cholesterol and blood pressure medications. Benefits versus risks. For millions of seniors, managing cholesterol and blood pressure is a daily ritual, often one involving multiple pills designed to reduce cardiovascular risk. Statins and antihypertensive drugs like beta blockers, ACE inhibitors, and calcium channel blockers are among the most commonly prescribed medications in the world. While these drugs have undoubtedly saved countless lives, their effects on liver health are often underappreciated. Statins, in particular, are widely used to lower LDL cholesterol and reduce the risk of heart attacks and strokes. However, they are metabolized by the liver, and in some individuals, especially older adults with pre-existing liver conditions, they can lead to elevated liver enzymes, inflammation, or in rare cases, liver failure. These risks are not theoretical. Studies have shown that about 1% to 3% of people who take statins experience some form of liver enzyme elevation. And though serious liver injury is rare, it's still a significant concern for seniors whose liver function may already be compromised. The liver is responsible for breaking down statins using specific enzymes known as cytochrome P450 isoenzymes. In older adults, these enzymes may not work as efficiently due to age-related decline or interactions with other medications that compete for the same enzymatic pathways. As a result, statin levels can build up in the bloodstream, increasing the likelihood of liver toxicity. Signs of liver injury caused by statins may include unexplained fatigue, abdominal discomfort, dark-colored urine, and jaundice, though these symptoms often go unnoticed or are attributed to aging or unrelated conditions. Routine liver function tests are supposed to monitor for these side effects, but many patients either skip their follow-ups or are unaware of their importance, allowing potential liver damage to go unchecked for months or even years. Beta blockers, another class of drugs commonly prescribed to manage high blood pressure and heart disease, are not typically associated with direct liver toxicity. However, certain beta blockers, especially those processed extensively by the liver like propranolol and labetalol, can affect liver function over time. In some cases, these medications have been linked to cholestatic hepatitis, a condition where bile flow from the liver is reduced or blocked, leading to liver inflammation. Symptoms of cholestatic hepatitis can be subtle at first, such as loss of appetite, low-grade fever, and mild jaundice, but they can progress to more serious complications if not addressed. Calcium channel blockers and ACE inhibitors have also been linked, albeit less frequently, to liver dysfunction. These effects may be idiosyncratic, meaning they only affect a small number of individuals in unpredictable ways, but in seniors with multiple risk factors, even a small chance becomes significant. What complicates the situation further is that many seniors are on a cocktail of medications that interact in ways most people don't realize. For instance, combining a statin with another drug that uses the same liver enzymes, like certain antibiotics, antifungals, or even grapefruit juice, can drastically increase the levels of statins in the blood, raising the risk of liver injury. Polypharmacy doesn't just increase the risk of adverse interactions, it places a constant metabolic burden on the liver, which must work harder and longer to detoxify the bloodstream. Seniors with diabetes, fatty liver disease, or a history of alcohol use are particularly vulnerable, as their liver function is already impaired. In such individuals, even a mild increase in liver stress from medication can tip the balance toward chronic liver inflammation and scarring. One of the main problems with liver injury related to cholesterol and blood pressure drugs is that it tends to be delayed and cumulative. A senior might take a statin for several years without any issue, only to develop elevated liver enzymes or nonspecific symptoms that gradually worsen over time. Doctors may miss these warning signs or attribute them to other conditions, allowing liver damage to advance. Unfortunately, when liver damage becomes clinically obvious, it is often well beyond the stage of early intervention. This makes routine monitoring crucial. Seniors should have their liver function tested at least once or twice a year if they are on long-term statins or antihypertensive drugs, and more frequently if they are taking other liver metabolized medications or have underlying risk factors. Despite these risks, it's important not to demonize these medications. Statins and antihypertensive drugs play a vital role in preventing heart attacks and strokes, which remain leading causes of death in older adults. The key is balance, ensuring that the benefits of these drugs are not undermined by avoidable liver damage. Seniors should work closely with their doctors to determine the lowest effective dose, consider alternative medications if liver enzymes rise, and explore lifestyle changes that may allow for a reduction in medication. Dietary modifications, increased physical activity, and weight loss can all contribute to improved cholesterol and blood pressure control, sometimes reducing or eliminating the need for drugs that strain the liver. In addition, seniors should be informed about signs that might indicate liver stress and encouraged to report them immediately. These include persistent fatigue, nausea, yellowing of the skin or eyes, unexplained weight loss, or a general sense of malaise. Even mild symptoms should not be ignored, especially if they appear after starting or adjusting a medication. Family members and caregivers also play a role here, as they are often the first to notice subtle changes in behavior, energy levels, or appetite that might indicate something is wrong. And above all, doctors should take time to educate patients, not just prescribe and move on. Understanding how these medications work, how they are processed, and what signs to watch for can empower seniors to protect their liver while still managing their cardiovascular health. Ultimately, the goal is not to stop life-saving medications, but to use them wisely and safely. With proper oversight, regular testing, and lifestyle support, seniors can enjoy the benefits of these powerful drugs without sacrificing liver health. Knowledge, vigilance, and proactive care form the trifecta of protection for aging livers in the face of modern medicine's double-edged sword. Antibiotics and antifungals. Necessary but potentially toxic. Antibiotics and antifungals are often life-saving medications, particularly for seniors who may face weakened immune systems and increased vulnerability to infections. However, these powerful drugs come with a hidden cost that is frequently overlooked: liver toxicity. The liver plays a crucial role in metabolizing antibiotics and antifungals, breaking them down into forms that can be safely excreted from the body. But in doing so, the liver itself can become overwhelmed or injured, especially with prolonged use, high doses, or when the patient has pre-existing liver conditions. Some of the most commonly prescribed antibiotics, such as amoxicillin clavulanate, erythromycin, and rifampin, are associated with liver inflammation, enzyme elevation, or more severe outcomes like acute liver failure. Antifungals such as ketoconazole, itraconazole, and fluconazole are even more notorious for their liver-damaging potential, often carrying black box warnings or requiring liver function monitoring during treatment. Seniors are particularly at risk due to several physiological changes that come with age. As liver function naturally declines, so does the ability to metabolize drugs efficiently. In older adults, hepatic blood flow decreases, enzyme systems slow down, and the liver's regenerative capacity is diminished. When antibiotics are introduced into this already taxed system, they can trigger a cascade of problems, ranging from mild elevations in liver enzymes to full-blown hepatitis. Unlike allergic reactions, which tend to occur quickly, liver reactions to antibiotics can be delayed, sometimes appearing days or even weeks after the medication has been started or completed. This delayed onset makes it challenging to diagnose and often leads to confusion among both patients and healthcare providers about the true cause of the symptoms. One particularly deceptive form of liver injury is drug-induced cholestasis, where bile flow is impaired due to the toxic effect of medications on the bile ducts. This condition is frequently triggered by antibiotics like ceftriaxone or amoxicillin clavulanate. Symptoms may include intense itching, jaundice, dark urine, and pale stools, signs that should never be ignored. If left untreated, cholestasis can progress to scarring and even irreversible damage. Antifungals, especially oral formulations, pose their own unique risks. Ketoconazole, for example, was once widely prescribed but has since been restricted in many countries due to its high incidence of hepatotoxicity. The problem lies not just in the liver's inability to process the drug, but also in its effect on mitochondrial function, disrupting the liver cell's energy production and triggering cellular death. Adding to the complexity is the fact that many seniors are on multiple medications at once, and antibiotics or antifungals are often added temporarily during periods of illness. This sudden addition can tip the liver into overload, especially when combined with other hepatotoxic drugs like statins, acetaminophen, or methotrexate. Polypharmacy increases the risk of drug-drug interactions, which can amplify the liver's exposure to harmful metabolites or interfere with its ability to clear them efficiently. For instance, a commonly prescribed antibiotic like erythromycin can inhibit liver enzymes that are responsible for metabolizing other medications, raising their levels and increasing the risk of toxicity across the board. Similarly, antifungals like fluconazole can interfere with the metabolism of diabetes medications, anticoagulants, and cholesterol drugs, creating a web of potentially harmful interactions. It's also important to consider the cumulative effect of repeated antibiotic use. Seniors with chronic respiratory conditions, urinary tract infections, or recurring skin infections may be prescribed antibiotics multiple times per year. Over time, this pattern can cause gradual liver damage that goes unnoticed until it manifests in symptoms like fatigue, abdominal discomfort, or abnormal liver enzyme readings on routine blood tests. Furthermore, some antibiotics can trigger autoimmune hepatitis, a rare but serious condition where the body begins to attack its own liver cells, mistaking them for invaders. This can result in chronic inflammation, scarring, and even cirrhosis if not caught early and treated with immunosuppressive medications. To minimize the risks, seniors should never self-prescribe or demand antibiotics for conditions like viral colds or flu, where these drugs are ineffective and unnecessary. Overuse contributes not only to liver damage but also to the growing global problem of antibiotic resistance. When antibiotics or antifungals are truly needed, doctors should choose the least hepatotoxic option at the lowest effective dose and for the shortest possible duration. Liver function should be tested before, during, and after treatment when dealing with medications known to carry hepatic risks. Seniors should be educated on the symptoms of liver distress and encouraged to report any changes in energy, appetite, skin color, or digestion that arise during or shortly after medication use. Natural alternatives for prevention and immune support, such as probiotics, vitamin D, elderberry, garlic, and a diet rich in colorful vegetables, can help reduce the need for antibiotics in the first place. Maintaining good hygiene, staying current on vaccines, and managing chronic illnesses proactively also reduce the frequency and severity of infections that require pharmaceutical intervention. Importantly, patients should avoid alcohol during antibiotic or antifungal treatment, as the combination can exponentially increase liver stress and risk of damage. Even moderate alcohol intake during a course of fluconazole or metronidazole, for instance, can result in a toxic reaction and sudden liver injury. Ultimately, while antibiotics and antifungals are sometimes essential, they are far from benign, especially for aging livers. Seniors and their caregivers must treat these medications with the same caution and respect given to any powerful drug. With careful monitoring, thoughtful prescribing, and prompt attention to symptoms, it's possible to harness their benefits while keeping the liver safe from harm. As we continue to explore the other classes of medications that impact liver health, the pattern will become clear. Knowledge, prevention, and proactive care are the cornerstones of protecting one of your body's most vital organs. Mental health and sleep medications. How they stress the liver. Mental health and sleep issues often become more pronounced with age, prompting many seniors to turn to medications for relief. Drugs used to treat anxiety, depression, and insomnia, including benzodiazepines, antidepressants, antipsychotics, and sleep aids, may provide short-term benefits but come with a long-term cost to liver health that often goes unnoticed. The liver is responsible for metabolizing the majority of these medications, converting them into active or inactive metabolites before they are cleared from the body. In aging adults, however, the liver's ability to efficiently perform this task is significantly reduced. Blood flow to the liver declines with age, enzyme production becomes less robust, and the body's overall detoxification system slows down. This makes seniors especially vulnerable to the toxic effects of psychiatric medications that require hepatic processing, particularly when these drugs are used daily or in combination with others. Benzodiazepines, such as diazepam, Valium, lorazepam, Ativan, and alprazolam, Xanax, are frequently prescribed to manage anxiety and sleep disorders. These medications are metabolized in the liver and tend to accumulate in the body more easily in older adults, especially those with fatty liver disease or other hepatic impairments. While benzodiazepines are not considered directly hepatotoxic in most cases, they can still induce liver stress indirectly by slowing down overall metabolism and overwhelming the liver when taken with other medications. Some benzodiazepines are metabolized into active forms that linger in the bloodstream, which prolongs their sedative effects and increases the risk of toxicity. Seniors with diminished liver function may experience confusion, drowsiness, or impaired motor skills at standard doses, all of which could be signs of underlying liver overload. Antidepressants pose another challenge. Selective serotonin reuptake inhibitors, SSRIs, like sertraline, fluoxetine, and citalopram are commonly used to manage depression and anxiety, yet they have been linked to rare but serious forms of liver injury. Most SSRIs are metabolized by liver enzymes in the cytochrome P450 system, which becomes less efficient with age and more easily overwhelmed when multiple drugs are taken concurrently. Although liver damage from SSRIs is uncommon, it tends to be idiosyncratic, meaning it occurs unpredictably and without a clear dose-related pattern. Some patients experience a sudden spike in liver enzymes, while others may develop hepatitis-like symptoms that include nausea, fatigue, abdominal pain, and dark urine. In rare instances, SSRIs have been linked to fulminant hepatic failure, a life-threatening condition that requires immediate medical intervention. Older tricyclic antidepressants like amitriptyline and nortriptyline also carry significant hepatic risks, particularly because they are metabolized slowly and can accumulate in the liver. Seniors taking these medications may develop chronic liver inflammation or experience liver toxicity that worsens pre-existing conditions like cirrhosis or non-alcoholic fatty liver disease. Even more concerning is that these drugs can alter the liver's ability to process other substances, potentially leading to toxic buildup from unrelated medications. Mood stabilizers like valproate and lithium, often prescribed for bipolar disorder, are well documented in their potential to cause hepatotoxicity, with valproate in particular being associated with dose-dependent liver enzyme elevations and, in some cases, liver failure. Valproate-induced hepatotoxicity can occur more rapidly in seniors and is especially dangerous in those with low-protein diets or nutritional deficiencies, which reduce the liver's ability to cope with the metabolic burden. Sleep aids are another category that can take a toll on liver health. Medications like zolpidem, Ambien, esopiclone, Lunesta, and diphenhydramine, found in many over-the-counter sleep aids, are all metabolized in the liver. In older adults, these substances often lead to prolonged drowsiness, cognitive issues, and poor coordination because they are not cleared from the bloodstream as efficiently. Some of these medications have also been associated with mild to moderate elevations in liver enzymes, and when taken long-term, they can subtly contribute to liver stress that worsens over time. Moreover, many seniors combine sleep aids with other medications that require hepatic processing, compounding the risk. The use of herbal sleep remedies, like valerian root or kava, may seem like a safer alternative, but even these natural products can be hepatotoxic, particularly kava, which has been banned in several countries due to its association with severe liver damage and failure. The effects of these medications are often difficult to isolate, especially when used in polypharmacy settings where 5 or more drugs are taken simultaneously. Liver enzyme elevations may be dismissed as incidental findings, and symptoms such as fatigue or nausea may be wrongly attributed to aging, depression, or other chronic conditions. As a result, liver stress caused by psychiatric or sleep medications is frequently underdiagnosed in seniors. To mitigate these risks, regular liver function monitoring is crucial for any senior taking long-term psychiatric or sleep medications. Doctors should be encouraged to order comprehensive liver panels at baseline and periodically throughout treatment, especially when symptoms of liver dysfunction, such as jaundice, persistent nausea, abdominal bloating, or right upper quadrant pain, are reported. Tapering off unnecessary medications is another effective strategy for reducing liver load. Seniors should work with healthcare providers to determine whether dosages can be lowered or medications can be gradually discontinued, particularly if symptoms improve or alternative therapies are available. Non-pharmacological treatments such as cognitive behavioral therapy, guided meditation, light therapy, or lifestyle changes can often provide relief from depression, anxiety, and insomnia without adding to the liver's burden. Simple interventions like exposure to morning sunlight, regular physical activity, a nutritious diet, and good sleep hygiene can make a measurable difference in mental health while preserving liver function. In cases where medications are absolutely necessary, choosing those with lower hepatic metabolism or shorter half-lives can make a significant difference. For example, some benzodiazepines like lorazepam are less reliant on liver enzymes and may be safer options for seniors with compromised liver function. Ultimately, the key lies in individualized treatment, taking the time to assess liver health before and during medication use, choosing the safest available drugs, and continuously re-evaluating whether the benefits still outweigh the risks. Mental wellness is essential, but so is the health of the liver that supports nearly every function in the body. Balancing the two is not just possible, it's critical for long-term vitality and quality of life. Early signs your liver is in trouble, and what to do about it. The liver is often referred to as the body's silent workhorse, not because it's unimportant, but because it usually gives no obvious signs when something is going wrong. Unlike the heart, which may signal distress with chest pain, or the stomach, which complains loudly when irritated, the liver suffers in silence. This becomes especially dangerous for seniors, who are already more vulnerable to the effects of medication and chronic disease. By the time noticeable symptoms appear, liver damage is often well underway. That's why knowing the early warning signs of liver dysfunction and understanding how to respond can make the difference between reversible irritation and irreversible damage. One of the first signs that the liver is under stress is fatigue. While feeling tired is common with age, liver-related fatigue is different. It's often persistent, not relieved by rest, and may feel like an overall sense of heaviness or low-grade illness that never fully goes away. This kind of fatigue can be caused by the buildup of toxins in the bloodstream, which the liver is no longer efficiently filtering out. Another early symptom is a subtle yellowing of the skin or eyes, known as jaundice. Even a slight tinge of yellow in the whites of the eyes can indicate that the liver is failing to process bilirubin, a substance produced when red blood cells break down. Seniors might overlook this change or mistake it for poor lighting, but it's a crucial red flag. Dark urine and pale or clay-colored stools are also signs that bile flow is being obstructed or reduced, a hallmark of liver dysfunction. When bile isn't properly produced or released, digestion suffers, leading to problems such as bloating, indigestion, or loss of appetite. Seniors might notice that they feel full after only a few bites or experience a dull ache under the right side of the ribcage, where the liver resides. This discomfort is often vague but can intensify over time, especially when combined with liver inflammation or swelling. Skin changes are another important indicator. Itchy skin without a rash, particularly on the palms of the hands or soles of the feet, can suggest the buildup of bile salts in the bloodstream. This condition, known as pruritus, often worsens at night and is one of the most overlooked signs of early liver trouble. In addition, seniors might notice spider-like blood vessels on their chest or shoulders, easy bruising, or delayed wound healing, all of which result from reduced production of proteins necessary for blood clotting and skin repair. Swelling in the legs, ankles, or abdomen, known as edema and ascites, can occur when liver function drops to the point where fluid balance in the body is disrupted. While many people attribute swelling to circulation or heart issues, liver dysfunction should also be considered, especially in the presence of other symptoms. Mental changes, although subtle at first, can also point toward liver distress. Seniors might experience confusion, forgetfulness, or difficulty concentrating, symptoms that mimic dementia or simply seem like normal aging. However, these cognitive shifts may be signs of hepatic encephalopathy, a condition caused by the accumulation of ammonia and other toxins in the brain due to impaired liver detoxification. This condition can progress rapidly if left untreated, affecting personality, motor skills, and ultimately, consciousness. Sleep disturbances, like insomnia, daytime drowsiness, or an altered sleep-wake cycle, can also be linked to early liver dysfunction. When the liver struggles to regulate hormones and toxins, it throws off the body's natural rhythms, leading to unpredictable energy levels and difficulty maintaining normal sleep patterns. Weight loss without trying, chronic nausea, or a metallic taste in the mouth are additional signs that the liver may not be functioning correctly. When the liver is inflamed or damaged, its ability to process nutrients is compromised, leading to a cascade of digestive issues and nutrient deficiencies. Seniors may begin to appear malnourished despite eating adequately, or find that foods they used to enjoy now cause discomfort. In severe cases, liver dysfunction can affect blood sugar regulation, causing sudden drops in energy or even episodes of hypoglycemia. If liver damage continues unchecked, it can progress to cirrhosis, a condition where scar tissue replaces healthy liver tissue, permanently impairing the liver's function and increasing the risk of liver cancer. So what can be done? The most important step is to catch liver problems early, before they escalate. Routine liver function tests are a powerful yet simple tool. These blood tests measure enzymes such as ALT, AST, ALP, and bilirubin, which can indicate inflammation, damage, or bile obstruction. Seniors, especially those taking long-term medications or with risk factors like obesity, diabetes, or alcohol use, should have these tests done at least once or twice a year. Any unexplained changes in appetite, digestion, skin, or mental clarity should prompt immediate medical evaluation, not a wait-and-see approach. Seniors should also keep a complete list of medications, including supplements and over-the-counter drugs, and review it regularly with a healthcare provider to identify potential liver risks. In addition to monitoring, preventive strategies can greatly reduce the chance of liver disease. Staying hydrated supports liver detoxification, while eating a diet rich in fruits, vegetables, whole grains, and lean proteins gives the liver the nutrients it needs to regenerate and perform its tasks. Avoiding excessive alcohol is critical. Even small amounts can be harmful when combined with medications or pre-existing liver conditions. Seniors should also be cautious with herbal supplements, many of which are marketed as liver detoxifiers but may actually do more harm than good, particularly when taken without professional supervision. Finally, regular physical activity, even gentle exercise like walking or Tai Chi, can help reduce fat buildup in the liver and improve circulation. Mental and emotional well-being also play a role. Chronic stress can elevate cortisol levels and negatively impact liver function over time. Practices like deep breathing, meditation, and staying socially engaged can support overall health and reduce strain on the liver. In essence, the liver's silence is not a sign of strength but a call for vigilance. By recognizing its subtle cries for help, seniors can take timely action to protect this vital organ and maintain the quality of life they deserve in their later years.